Hi everyone, I'm Sarah Macias with Real News Communications Network. Happy Wednesday. Today I'm here with Dr. Al Johnson with Johnson Medical Associates. We're here to talk about the month of March. The month of March is Brain Injury Awareness. First of all, let's start off with what is brain injury?
Well, brain injury is when your brain gets shaken up, and it could be from all kinds of different injuries, whether it's from falling down and hitting your head, which initially is a concussion. It can cause brain bleeds, which then causes increased pressure in your brain, and you need surgeries in some cases to stop it. So you have concussions from trauma, automobile accidents give brain injury. You can have sports injuries, which get hit in the head with a basketball. Football, you have repeated head injuries in some people where they get repeated concussions. A lot of times brain injuries are slow to recover. In concussions, 30% of people that have concussions continue to have symptoms 30 days later. So you think it's just a short-lived thing, but it's not. It's where the brain tissue is damaged and does not function right.
And the CDC reports that there are 1.5 million Americans who live with TBI, which is traumatic brain injury, each year. What age group is the most at risk, or is there an age group that's most at risk?
Well, every age group is at risk, from infants that fall off tables or fall down while they're trying to walk, hit their heads on the counter, to senior citizens that are unsteady on their feet, pass out, fall, hit their heads. So every age has a risk factor to it, and it's not just delegated to clumsy people.
And what if someone were to, fall or get hit on the head and they're like, oh, this isn't a big deal, and they don't really think twice about it? Is there a possibility that they'll feel symptoms maybe later, not right away, or how does that work?
Yes, symptoms can be delayed, where you get sensitivity to light, blurred vision, difficulty in speaking, difficulty in thinking, persistent headaches, fatigue. All those brain functions can be a part of the whole head injury situation. And you may have a few symptoms after you hit your head, but then the next day they may be persistent, where you can't tolerate loud noises, and you can't think very well, and you feel tired, and you get some dizziness. If those symptoms occur, it's best to be evaluated right away, because it may be more than just a concussion. You can have a bleed from where you lacerate an artery in your head, which puts pressure on your brain, and it can kill you.
And for some people, do brain injuries heal? Do they go away?
Well, brain injuries typically resolve slowly. If you have a concussion and it's a mild concussion, symptoms may go away within a few days. Many times, though, they persist. Traumatic brain injuries where you have open head wounds, where it's affected part of the brain. Then, besides time, you can use hyperbaric to help recover from a concussion, from a traumatic brain injury. And what it does, it helps the tissue that's damaged heal. It helps it heal faster. So where in a stroke, say, patient, you have an area that's dead and then an area of cells around it that are idle. You wake those idle cells up. And same way with a head trauma situation. I see quite a few vets that have had traumatic brain injury, and most of those are percussion injuries where they've been exposed to a blast, and it's had pressure on one side, shove their brain one way, and then it pops back the other, similar to just what you get in automobile accidents. They call it a coup contra coup type injury, where the brain goes back and forth and rattles on both sides of your skull, and creates then damage to the brain tissue.
Okay. And what about for the caregivers? Do you have any advice that you can give them?
Well, the caregivers need to be understandable. They need to understand the person, be compassionate, because a lot of times a person may appear like they know what's going on or that they understand, but they may not because of the mental changes that they have, the capacity to understand. So if a person's personality changes, their awareness changes, then they really need to be followed up with a doctor at that point. The big thing is if you are not making progress or you want early intervention, hyperbaric oxygen treatment, which is a treatment where you're in a chamber like a chamber they use to treat diving accidents. You're under pressure, 100% oxygen, creates increased oxygen to the brain 10 to 15 times depending upon the pressure, and it helps heal the brain, decreases the swelling, decreases the inflammation, and you get recovery quicker with it.
Okay. And for anyone out there who wants a little bit more of information, they could visit your website or call. Would you mind giving us that information?
Yes. You can call the office at 972-479-0400, or you can go to the website, which is hyperbariccentersoftexas.com, and there's a lot of information on hyperbaric and traumatic brain injury.
All right. Thank you, Dr. Johnson.